Good afternoon and happy Wednesday to you all. Thank you for joining us this afternoon in the fourth of our series of Breaking Barriers System of Care Masterclasses. Today, we're going to wrap up our series for 2021 and talk about shared community and shared governance, working towards one child, one family, and one plan. My name is Richard Knecht. I'm the managing partner at the Integrated Human Services Group, and joined today, as always, by my partner in crime, Steve Hornberger at San Diego State Social Policy Institute. Steve, do you want to say hello?
Yes, hi everyone. This is clearly my favorite topic because everything happens in the community. I'm looking forward to the dialogue. We've got some great SMEs and people to share their experience with us today. So looking forward to the dialogue.
Thanks, Steve. We are excited today to have with us Ron Brown, Jack Hinojosa, and Annie Wu as our guest masters, and they'll introduce themselves a little bit more fully to you a little later on. And then as we wind up our series for the year, we're pleased and honored to have Toby Ewing with us to give us some closing remarks, and you may hear from Toby as we go through the next hour as well. So really, I'm thrilled to have the support of such wisdom in our conversation today. Mm-hmm. As always, we're here with the support primarily of the Mental Health Services Oversight and Accountability Commission. I appreciate their ongoing commitment to furthering this conversation, this critical conversation around integration and connectivity towards effectiveness on behalf of young people in California. And here also with the support of the San Diego State University Social Policy Institute and the Integrated Human Services Group. So we appreciate our sponsors as always. If you're new to our conversation today, you may appreciate that we're here in pursuit of some common purposes. We see the Breaking Barriers effort as a way of creating a common community of practice, of sharing resources across the systems that support young people and their caregivers, and engaging in conversation with community voices, which are so critical to the successful transformation of work in the public sector. These master classes are intended to be skill building opportunities for you as designers and implementers. And so while the focus is on technical elements of design, we're not here really in consideration of policy other than as it relates to the technical implementation of the work. But we really would like to focus on the building blocks and the materials and the glue and the mortar, if you will, of building a system. And that's the primary unique purpose to Breaking Barriers if you're new for us. It's important to have some California context because systems of care, integrated systems in California are unique. As many of you know, there are now obligations on 58 county partnerships and their regional center partners to have a memorandum of understanding that captures how they do their work together. Each of those establishes a way of maximizing revenue and linking systems in critical areas that are necessary for good work. What is unique about the system of care effort in California under Assembly Bill 2083 is that it is not a project or a program or an initiative. It is a structural way of being in partnership with other agencies and those who serve young people. So it provides a very unique opportunity to build a container or a clearinghouse for all related reforms, including a couple of those we have here. And there's a much longer list, of course. But when you think about the other reform work going on in California in school, mental health, welfare, probation, and regional center developmental disability services, the system of care provides that unique container for us as we approach this work. This is, again, the fourth in our series. We have dealt with content over the last, 6-7 months now in terms of shared leadership, shared data, sharing of finances, and how to maximize the revenue opportunities. And today, of course, we're talking about shared community. If you have not availed yourself of the resources at breakingbarriers.org, you'll find there a toolkit, as well as a link to a YouTube page that has many, many resources now to support the integrative work going forward. Steve?
Yes, and again, just to build on what Richard's already said, the intent here is to how do we break down some barriers and the silos that exist between the various child and family serving systems to create, our dream would be to create each child having a plan to how they can optimize their opportunities and well-being to have a good and healthy life. The qualities that we always see as important is that it needs to be youth and family led. It needs to be grounded in equity and justice, because clearly we need to not only redress historical inequities, but we need to make sure what we're building going forward is equitable for all. It needs to be culturally, linguistically, and developmentally responsive. The community needs to own it. Too often in the past, we've tried to create systems-driven changes that made sense for the systems stakeholders and mandates, but didn't really align well with what communities needed for their own members. And it needs to be strength-based. We need to be long past needs assessment and deficit funding and deficit planning. We've laid out this 10-step process that I think covers how we get from here to there and lay down a foundation so that we can build together. Obviously, today, we're going to be more focused on number one, in convening public and private leadership groups to develop an integrated governance plan. Number four, inventory available public and private continuum of care. And number nine, implement communication so that the children and youth and families are available. Because it's with those elements and what you're going to hear from the experience of our guests for today, we can begin to shape a more grounded and realistic and relevant and frankly achievable shared community so that all of us can have an opportunity for a good and healthy life. Next. And so quickly, because we know we got a lot to cover, we're asking each of the Masterclass guests to give a brief introduction about their experience so that you can understand some of the context when they speak later and answer questions. Ron?
Hi, welcome and good afternoon. I'm Dr. Ron Brown from Children's Bureau. Children's Bureau is a 117-year-old nonprofit serving LA and Orange County, reaching nearly 50,000 children and families each year. And we do this through multiple sources and approaches to strengthen and support vulnerable children. In particular, nearly a decade and a half ago, we started looking at community well-being as it supports child and family well-being and created the Magnolia Community Initiative, a collective of organizations, cross-sector organizations working together along with community to strengthen and capture probably the densest population within Los Angeles County. So what I'll bring today is some thoughts around our experiences there and how we've parlayed those into other communities that we've been serving with the same ideology.
Thanks, Ron. Jack?
Hello, everyone. First, I want to thank Breaking Barriers of California, Richard and Steve for the invitation. And of course, Toby, our moderator, who will be assisting us today. And of course, our distinguished panelists, Ron Brown and Annie Wu, for the opportunity to join you today. I'm Jack Hinojosa. I'm the Chief Executive Officer of Child Development Resources of Ventura County. We're also commonly known in our community as CDR. The mission of our organization is to provide a foundation to build promising futures for children. And we collaborate with parents in the community to deliver programs that enrich lives. Our organization is the 7th largest private nonprofit community-based organization in our county. And this past year, during the pandemic, we celebrated 3 major milestones. Our agency turned 40 in July of 2020. We also commemorated our 55th anniversary of the Head Start grant, Head Start program, of which CDR is the first and only grantee serving our community in Ventura County. And then lastly, we also celebrated our 25th anniversary of the early Head Start, serving pregnant mothers and with children 0 to 3 in a home-based environment. Our organization also partners with over 600 child care centers, licensed child care providers, family, friends, and neighbors to administer state-funded subsidized child care and a resource and referral program. And we contract with the California Department of Social Services and County of Ventura Human Services Agency to administer the CalWORKS Stage 1 subsidized child care program. I just want to add that we started a new initiative in January 2019, It's referred to as the YES commitment, and it's to inspire all of our staff, over 400, to develop and maintain a positive thinking and to build on the energy skills and team support to create a healthy working environment. So we're a community in place of yes. We believe strongly in inspiring children, parents, and staff with an attitude of yes.
Thanks, Jack.
Thank you.
And Annie?
Hi, everyone. Very happy to be here. Thank you so much for the invitation. So I'm Annie Wu. I'm a health planning specialist at Santa Clara County Public Health, and I coordinate the East San Jose Peace Partnership. So Peace is a grassroots collaborative made up of residents, CBOs, and different government entities working together to build healthy, peaceful, empowered community in some of the poorest and most needy neighborhoods in San Jose. So Peace was established about 5 years ago through a CACHI grant. So CACHI stands for California Accountable Communities for Health. And yes, we've been around for about 5 to 6 years, and the work that the issue that we're addressing is violence prevention, and working through trauma, through community-based trauma, and using a healing-centered approach.
Thanks, Annie. And as you can see, we're addressing and coming at the issue of community from very different perspectives to help for you to appreciate that it's a shared community. All right, Richard, all yours.
Steve, thanks very much. And thanks, Ron, Jack, and Annie for joining us. We would, as always, avail you of the chat box to drop your questions into chat. This is intended to be a highly interactive conversation. And while you think about what those questions might be, we would love to prime the pump, if you will, with a couple of inquiries here. And we'll turn first to Ron and invite Ron to ponder with us a little bit about what a definition of shared community or shared governance might mean in your experience. So Ron, lead out for us if you would.
Yeah, thank you. And I'll reflect back onto my comments about the Magnolia Community Initiative and what we did when we started in 2008. And thinking about how we engage with community, we were moving into a new facility in a region that we hadn't been before. So we had to spend the previous year and a half understanding organizations that were already there, the systems that were present, and the community members that had a voice and were carrying a voice, in addition to those that weren't carrying a voice in that community. And so once we opened our facility, we brought people together in a shared platform to create a shared vision collectively for the region, if you will, amongst all the organizations. And this included, whiteboards and a whole lot of erasing and a whole lot of people in a big room kind of working through this shared vision statement. And then once we got that shared vision, I can say that, vision statement, thank you, sorry, I got stuck. We were able to look at how we wanted to approach this collectively and really blending the systems together with the community members and creating a collective ownership. This is an unfunded collaborative model. So nobody was paid to be present, no organization, no individual was paid to be present to participate and create the shared vision, but then to move that vision together with a series of committees that were focused on what the community shared as their needs, what the community shared as their wants, and the ideas that really emerged from this large series of meetings together. So it really is, for us and for me, it really means first creating a shared vision and doing it collectively across all systems, and then collective ownership. And then the final process to that is that it doesn't stop once you begin. That is actually just the start. The hard work is at the beginning, but the real work is following that, and kind of gets to the point of how do we make sure that we're tapping into the original questions on a regular basis, so we have this continuous quality improvement process built into our system. And I'll stop there. Thank you.
Lots to think about, Ron. Thank you. Annie, what's your sense about a shared, a definition for shared community?
Yes, that's one of those hard questions. Like you think that, when you come out of school or when you work in government, you kind of have a concrete idea, but then once you actually start to do the work, you realize just how quickly that breaks down, right? How complex and how difficult it is. I think for us, we really kind of went back, peace, when we first started, we started like, one of those more typical, more traditional kind of collaborative efforts, created by governments. It's very much, very like system, we call them system partner heavy or CBO partnership heavy. So a lot of executive directors, a lot of like managers from different institutions sitting in our collaborative. But over the years, we have really kind of evolved, I would say, to include a lot more kind of grassroots on the ground community members, community leaders. And in doing that, we really realized we need to go back to the ladder of participation, is called, or I think it's called different names, ladder of citizenship participation. So really moving the collaborative from, or moving kind of the use of resident voices or community voices from this consultation advisory role to a co-design, co-ownership role. And really kind of really wrestling and interrogating ourselves with what that means, right? And so we did a lot of similar to what the first speaker shared, a lot of shared vision planning, a lot of shared work planning, shared evaluation development. But really at the end, we kind of came back to kind of a lot of just conversations, whether one-on-one conversations or group-based conversations. And really giving the mic over to the resident leader and just asking them what are your challenges you're facing on a daily basis, and what are the things that will help you, right? And really listening. I think it just goes back to listening and being very, very iterative, kind of almost at times throwing out. We have a lot of models and frameworks, but sometimes we need to kind of just put that aside for a bit and just go back to people with lived experience, and kind of go from the ground, a very kind of a grounded, iterative approach to building up a model for community participation and shared governance.
I love that. Turning the mic and the power over to the persons with lived experience. Good stuff. Thanks, Annie. Jack, other reflections from you about a definition for shared community or shared governance?
From my experience, what's critical is the building of trust. And the word collaboration really is talking about relationship building. And there has to be that upfront investment in building in partnership, but really building relationships that are long-term. We're very fortunate here in Ventura County. We have, we're just a right size of a county where we know each other, community-based organization, government entities, and we always consider the key stakeholders, and most importantly, the services and programs that the clients need, and those gaps in services as well. So I think the two speakers really hit on the key points, but trust building is an important part for an effective community shared approach.
Thanks, Jack. Appreciate that. You do have a rich legacy in Ventura with your partners for this kind of work. Thank you. Let's tackle one more of these questions, and let's come back to Annie if we can. When you think about your experience in Santa Clara or other places in this domain, if you will, what's one or two of the obstacles that you've commonly encountered in this effort? Can you talk to us about the obstacles?
Yes. One of the, I don't want to call it an obstacle, but I'm learning to think of it more as a challenge or like a tension, meaning moving beyond this idea that it's something I can solve. This idea of, when you approach community, and by community, I mean people with lived experience and grassroots CBOs that are serving people with lived experience, right? That's the community that we're talking about. We go to them, and the work that we're trying to do with Peace as a part of the ACOCHI's Accountable Community for Health model is we're talking about system level alignments, right? Aligning healthcare systems with other institutional systems, the education system, the food security system, very high level, very complex kind of system change, system redesign kind of work. And you go to people who are just trying to put food on the table, or who are maybe used to more kind of maybe dealing with like maybe redesigning services that they touch and feel, like very concrete things, and having them kind of address these very high level things. Where do you find that balance, right? And where do you where do you recognize their need as opposed to your need? Because some of these questions that we're asking our resident leaders are things that maybe they haven't really thought about, and are maybe not top of mind for them. But for them, it's where can I get information to help my community? So that's kind of the biggest challenge, as well as time commitment, right? Time commitment and capacity, and also addressing kind of that reciprocity aspect of the questions that you want community members to lean on, to give input on, are maybe not necessarily the same questions that community members, leaders have for themselves. And so really striking that balance, and how do you find common ground? How do you align your efforts, right? So that you're all working toward the same goal, but you're meeting needs on both ends.
Thanks, Annie. Jack, talk to us a little bit about obstacles in your experience. What's been the primary challenge for you?
Well, as Annie mentioned, we're talking about one of the items that I've learned and experienced is translation issues. And I don't mean translation of language. I mean the private sector has their own language. The public sector has their own language, as well as governmental. So in building that trust, at the very beginning, we look for common language that is respectful and has a cultural and equity perspective as well. So I think that there has to be an investment in the nomenclature, and that people are on the same page and aligned. Along with what I indicated earlier with building trust, it has to be very intentional, infusing key stakeholders, thinking about the community, the families, the children, their strengths, and believe in foster co-powerment rather than empowerment. Because many of our families, though they have challenges and are searching for support, it's very strength-based in terms of what they can bring to the table as part of the community, their community voice. And then I also find that my experience is that sometimes we just have to be a cheerleader, because the work is not easy, and we have to support the process, and lastly, be patient, because it is hard work and it does take time. Those are some of the lessons and experiences that I've learned in collaboration with our key stakeholders and the community here in Ventura County.
Jack, thanks. Your reflections around a common language are powerful. I think it's really a universal conversation when we're building these kind of partnerships to establish what the language will be, how the messages will be communicated and heard. And so often we expect, I think, people with lived experience from the community to be able to speak bureaucracy instead of on the public side, or the professional side, if you will, being able to communicate in a way that's plain and understandable, right? So that the system can be navigated. I love that thought. We'll come back to that. You've begun to take us, I think, appropriately into the part of the conversation around solutions, but we'll certainly come back to those, Jack. Thank you. Ron, additional thoughts about challenges or obstacles?
Yeah, I think the biggest obstacle is always us. We're the biggest obstacle that we have. And it's the idea of lived experience. And I am a firm believer that context matters. And yet, I have a PhD, but I'm not a context expert. The community members are the context experts, not us. So we come out this thing with the belief that we can service deliver our way through this and help the challenges that community members face by service delivery. And we ignore the fact that there are absolute needs to change the systems that they live in. Absolutely concrete ways that the systems work against them, and that we can actually be a help in that, but we get so focused on delivering our service and counting our widgets, et cetera, without thinking beyond our own shores. So really moving that forward, and how we do that is partly about how we engage, as Jack said, in the language and understanding the language of community. And building trust is a real critical component, and is one of the key components when we built Magnolia. And building that vision was really about building trust too, and building a shared language with which we can all speak to. But we, as I speak as a nonprofit agency, we get in our way more often than anything else. So.
Mm-hmm. Yeah, thanks for that. In both Ron's and Jack's reflections just now, you've begun to reflect a little bit on this idea of equity and of course, sharing governance responsibility, sharing accountability, sharing power, if you will, is really at the heart of that conversation. And we had a question posed to us pre a seminar that kind of invited us to think about this from the lens of how do public systems approach community partners from a position of outreach and engagement, as opposed to waiting for the consumer or the community to knock on the door, right? So intake in a bureaucratic sense is one thing, and public systems are okay at that, but actually being in position to engage before there's a deep end need, if you will, or a significant need. How does a partnership approach that question so that we don't wait for young people and their caregivers to be in more extreme need or more complex need? What do we do about that? Any ideas in terms of that as it relates to getting us to a place of equity?
Good thing you threw out the hard question in the middle, Richard.
Right, right.
But I think what you're referencing, and I think knowing all three of the presenters, all of them work to go upstream, if you will, the language of now, how do we start to build relationship and ongoing activities with, so that we know what's happening in the community and we could be a little bit more proactive. I'm thinking of Ron's neighborhood ambassadors. I'm thinking about what Annie does in terms of grassroots, and I know what Jack does in terms of all of his staff, and so any one of them could answer that question, Richard.
Yeah, I can maybe jump in and start. For us, we really leaned into the Kochi model of accountable community for health, or they're calling it a community council model, which we're still on our way trying to figure out how exactly it works, but ideally it's this council that you set up, right, made up of the community, whether it's CBOs or residents, leaders, or whoever is the people you're serving and you're collaborating with, and it's through a formal structure where you have kind of shared governance, shared vision already figured out, and you're regularly tapping into that community council. What Kachi is calling it as building that muscle, right? Building the muscle of aligning efforts, and throwing out a lot of Kachi terms because it's just so wonderful, and building that muscle of building mutually reinforcing activities, right? Like really training and helping people learn how to work together, how to have shared decision-making, participatory decision-making, so that when, a crisis comes, or when like these big decisions need to be made, you're not kind of scrambling, to kind of get input, and it's not going to be like window dressing or checking off a box, but you have that established, robust kind of community body present who are partnering with you and who can kind of readily kind of feed into any kind of system redesign or any sort of decision-making process you're trying to do.
If I could just add, in Ventura County, the process of where we're at now, we have a collaborative called the Essentials for Childhood of Ventura County. That group is made up of community-based organizations, public, private, government, Ventura County Human Services Agency, and all of the divisions at the County of Ventura. But when I reflect back on where we are now, it actually began almost 5 years ago with the formation of a citizens review panel and a Children's Services Oversight Committee that spent about a good 1.5 to 2 years sharing data, identifying gaps in service, talking about the challenges in terms of connecting families with the various services and programs. And it was very deliberate, it was very intentional, and it was extremely informative. We went to the table on those meetings and we thought we brought our own perspectives, but it kind of opened our eyes to really what is going on in the community. And that evolved into a Ventura County prevention plan, and then subsequently evolved into the Essentials for Childhood for Ventura County. So as I illustrated earlier, it's hard work, it takes time, you have to be patient. But when you have a shared vision and a common language, and you have active participation, including from the neighborhood, the community voices, the parent voices, you can have some successful outcomes to overcome some of the challenges and the barriers that we described earlier.
And I'll just finish up and say yes to everything Jack said, and add making sure that you have opportunities for community to be engaged that's convenient for community, not for agencies and systems, so that you're actually getting the people there, and that you're creating shared ownership is what we're really talking about, and that it's ongoing. And it is that whole child, whole family, whole community approach, and looking at that in a way that is futuristic, is looking at continuous engagement, and really allowing community to own their community. It's not us, it's them. And we partner and we facilitate. So it takes a great deal of intentionality in our work.
Ron, thank you. Appreciate that. Let's pause for a second and check in with the chat conversation. Thank you, Deborah, Luz, and others for reflecting a little bit with us on this conversation specific to language. And then Luz reflecting that having a common goal, of course, is a way to unite, right, around what's the purpose, and having a unified purpose, of course, if that's collectively held, is a way to kind of hold through the challenges and through the developmental obstacles of the collaborative, because we've got a clear vision about what the North Star is. So appreciate that. I see a nice question from Kathleen in chat, and I want to maybe pair this question up with just inviting any of our masters to begin to reflect a little bit more deeply on how you've successfully overcome these obstacles, because her question really invites, I think, a thoughtful inquiry here around, as you've done this work, what's the impact been on your organization? What have you seen organizationally or relationally within your own business or your own entity from this work? What's the impact been? Anybody want to lead out there?
I'll jump in and say, I don't think we have overcome it. It's a continuous process. We've gotten a lot better. And we have to listen every day to community telling us how to keep getting better. So I don't know that we have actually overcome it, but the challenges continue to be in front of us as ways to engage differently and to think differently. And so it progresses. And if we're not learning, then we're losing the community. So we have to do that. What it's done for us as an agency is it shifted our work from a child and family delivery system to a child, family, and community delivery system. So now we're owning not just the one that I talked about, but other communities in Anaheim, in the Antelope Valley, in Los Angeles County, Anaheim and Orange County. And we're engaging with other communities across the country that are thinking more collectively and more broadly as a result. So it has changed my agency fairly dramatically in how we look at our world.
Thanks, Ron.
Well said.
If I could piggyback on Ron, we have had a tremendous shift at our organization. As I mentioned in my introduction, we launched a Yes Commitment initiative internally, but we're going to carry on that initiative with our community partners at some point in 2022 as well. So a way of engaging the community to be more in alignment with the needs of our families and children that we serve. On the Head Start side of our house, it's really built on comprehensive services that serves the whole child and families, with investment in staffing in various, health, disabilities, mental health services. And we're actually out in the community. So we have 28 centers that are located in just about every city in the county. Where we're beginning to see a shift is with the transfer of many of our programs from the California Department of Education to the California Department of Social Services, which is really going to change the interaction in our subsidized childcare program. So families that come in that are qualifying for childcare services, we're going to be broadening that so that we're looking at other services and programs that those families need that in the past haven't been funded. They haven't been funded, so that allowed us to, even though we had a vision of serving the whole child and family, without the funding to support that in our state funded subsidy program, it was difficult to achieve. So we've been doing a lot of advocacy at the state level to make sure that CDSS understands the important role of our program, resource and referral, subsidized childcare, family childcare education network, and our community partners of over 600 providers in the community that are providing childcare, high quality childcare in our respective communities. So we're optimistic that lift and shift is going to happen because it's one of the high priorities for CDSS, and we'll continue to advocate and support those efforts.
Jack, thanks for that. You mentioned that effort between CDE and DSS, and we should celebrate when big government does try to do the integration thing better. And what Jack's referencing is the recent move of somewhere around 100 employees, I think, from CDE over to DSS in their early childhood's work. So good stuff in Sacramento. Thanks for that. Annie, thoughts here from you?
Yes, I'll just add, I think for us, it's because the community that we're dealing with are really literally like resident leaders and very grassroots CBOs. I think we learned what we had to be just extremely flexible and be willing to change and be willing to pivot and not be so tied to or married to kind of our large frameworks and our 5-year work plans, or even some of our very concrete indicators, these population health change indicators that we committed to, during the time of COVID. So one thing we have at Peace is we have a wellness fund, this braided and blended pool of funding that's designed to support these long-term strategies, right, that the community has identified. But during the time of COVID, we literally had to just put that aside because, our community is coming to us and saying that they can't feed their children, they can't feed their families, they can't pay the bills. And so we literally had to, very quickly create an ad hoc work group and just very quickly disperse. We dispersed up to over $600,000 into the community, into a lot of undocumented families that do not have other assistance coming in, and just kind of put some of our big work plans and big procedures and protocols for these fund disbursement kind of aside, and really just be very responsive to community needs. And that's something that that going back to that relationship building and reciprocity, right? So then we kind of have more cred with the community, so then we can then ask them to come back and to really kind of walk with us or journey with us as we deal with these long-term system change issues that we're trying to tackle.
That's good stuff.
If I can also share, Richard, that we also built on the relationships and networks that were set up to address two major happenings here in the United States, as well as in our respective counties. One was the 2020 census. And in Ventura County, there was over 300 organizations, public, private, government. And in 2010, that our census numbers, we were dead last in terms of the 58 counties and our response rate to the census. And through that collective effort and relationship building and trust building, we ended the 2020 census with 4th in the state in terms of our response rate. And that has just carried over. So we don't want that network to disband. So now we've shifted the focus on other area, which is the COVID-19 vaccination, education, and awareness. So I think building on what other networks are being established and not letting those go by the wayside, but see how you can creatively continue to support those networks to work on other community issues that can serve our families and community much better and much wiser and smarter.
Thank you, Jack. I see an inquiry further from Kathleen. Would love to invite Kathleen for you to come off mute if you want to have a conversation with our guest masters today. If I'm interpreting the question a little more deeply, you're interested not just in the organizational kind of process changes, but like what's measurable on the ground, right? How has this changed the community impact? Do you want to elaborate, Kathleen, on that?
No, I think you said it very well. I'm very much on what's the impact. If you have numbers, that's great, because then I get an idea of what I might want to take into my community. And I know it's tough. I very much am aware of how tough all this work is.
Mm-hmm.
So I'm more looking at impact, because maybe there's something I can borrow and replicate.
I appreciate that. Well, while the guest masters are pondering on that, I'll just reflect in a prior lifetime running a county department, when we effectively built some shared governance at the executive level, and I had a little network of partners. The number of complaint calls to my office as the department lead dropped by about 90% because I had effective partners in place who could communicate the mission of my organization vis-a-vis the community, and so it lowered our complaints significantly, which lets people get back to doing other work, right? So thoughts from the guest masters around what are the results? What's the bottom line?
I'll share what we've been doing, and we've been using the Early Development Index, which is a measure of, it's a population level measure that was created in Canada, used Canada, Australia, LA, Orange County, Florida, Texas. And it measures 5-year-olds pretty much, but it's not really about the 5-year-old. It's about the social platform that the 5-year-olds live in. And so we use that to have an understanding. It's done every 3 years. And then we overlay that with the Bruner Risk Index, which is based on demographics, general common demographics. And we look for variances, and we actually have been able to see significant improvement year over year with the EDI, and how it contrasts so greatly with the risk index that our communities would be looking at if we only apply general demographics upon them.
Mm. Good stuff, Ron. Thank you. Annie, some thoughts here about results in Santa Clara?
Yes, that's a tough one. I think Conchi's model is very, very much data-driven. It's supposed to be very data-driven, results-driven, and we have, for the last 2 years, we have undertaken kind of a planning framework called results-based RBA, results-based accountability framework, right, where you start with the result that you want and you work your way down or up. I have to confess, it is very difficult when our goals are so lofty that we're trying to do kind of system alignment. You know, for some of the things that we've been working on is reduce displacement in East San Jose, and also another one we're working on is to build capacity in our promotora, our community health worker workforce, to really institutionalize that workforce to provide effective domestic violence education in the community. So kind of these kind of very system change and practice change, clinical practice change work that we've been trying to do. I think some of our impact or results-based indicators are hard to measure over the short term, but some of the things we've been tracking is basically the number of partners that continue to be involved in our collaborative over the years, number of residents who have become involved and have moved on to take bigger and bigger roles in our collaborative, number of policies that PEACE has supported or advocated for, and the outcome of that. And also another thing we've been tracking is kind of the number of grants or just monies that we've been able to acquire or to fundraise, and how that money, how much of that money has impacted different CBOs and residents. So a lot of kind of process oriented indicators, but yes, that's what that's what we started to focus on over the years.
Thanks, Annie.
And I think, Kathleen, you asked the really hard question, and what happens is, what's the difference between some performance indicators that show that we're moving forward in our goals, as well as what are the processes? And some of these at a micro level, meaning at a child or family level, we might not see over 2, 3, 4 years in terms of well-being. We might see that there are less recidivism, less reentry into child welfare, those kinds of things. But my sense is you're looking for how do we know that we're making a positive difference? And that's usually a longer term scale or vision that we have to have. But I think Ron, when he referenced that they had continuous quality improvement, allows us to see that, you know, every quarter, every 6 months, every year, are we moving in the direction we want? And if not, what can we do about it? As opposed to just leaving the data out there.
Mhm.
Ken, if I can, I'm sorry, Richard, if I can, you know, I want to add from the Mental Health Commission's perspective, Kathleen, I think you're asking the right question.
Yeah.
We really think through this lens of, and we're a stakeholder organization. We're a commission. We're at the state level, but the commission is made up of appointees who represent the community. And so in some ways, it's not necessarily what people are thinking about, but in many ways, a body like this is an example of shared governance, where elected officials, or in the case of a governor, you know, the commission has authority that is granted to people who are polled from the public to play, you know, to create this board. We think about that question a couple different ways. One, we create certain kinds of tools. And so those tools aren't the outcomes you're looking for, but one of the ways we measure our impact is, are the tools that we're creating being used? And so if we create tools that others in the community find valuable and begin to use those tools, sometimes it's information, sometimes it's a process, sometimes it's the way we communicate things. And so we look to see how the kinds of language that we're using is being replicated in the voices of others. That gives us cues about the work that we're doing is actually very helpful. And then we think about how those tools actually are creating impact in very discrete ways. So, you know, it could be that we're, for example, in terms of community empowerment, we grant more than $5 million every year to elevate community voice. That community voice then gets used to shape the decisions that other people are making. And we can reflect on that very explicitly. So there's one example. We're a small partner, donor to a national NPR film that Ken Burns is doing on the youth mental health crisis. And in talking with us and engaging our stakeholders, they've changed the sort of the perspective or the voice of that work because of the influence that the community stakeholders that we are empowering have been able to bring to the conversation. You know, so that's not our voice. That's a magnification of the tools that we're using to really support the community voice that is influencing decision makers beyond our direct work.
Good stuff, Toby. Thank you. We got about 10 minutes remaining, and I want to give maybe each of our guest masters a chance to reflect either on the last question from the prior slide, which is how are you overcoming obstacles, or how are you addressing this process successfully, or to choose one of these three other questions if one of them resonates with you more than the others, and just invite Ron, Annie, and Jack to give us another 60 seconds each, and then we'll begin to tie this up and then turn to Toby. Ron, got some thoughts for us to share?
Yeah, I mean, obviously key issues that community stakeholders are still, let's not fool ourselves, the pandemic is still very fresh in everyone's minds. And of course that lends itself to technological supports and the needs from them. Even though we're 19 months into this pandemic, there are still shortages of technology in some of our communities. The ability of some of our families that have multiple children in particular, and working parents to have access to technology if children are still at home. Fortunately, many children are back in school and yet they're behind. So we have social connections and developmental connections that kids have been missed. So there's that piece. The sense of belonging in a community has been muted in all of our communities because it's been doing just like we are on over Zoom. And what I have found and benefited from greatly is walking into the lobby of our family center and seeing families collectively having lunch there together, engaging, or while one parent's in class, another's watching the other's kids, and that can't happen at the moment. So that level of engagement. Those are just the basic frameworks. So we're back a few steps, if you will, and looking at how do we take advantage. We've done a whole lot of work to really use the Zoom platform. And even though we built it around the community, it's an open platform. So we find people joining the meetings from miles and miles away, even though we're trying to do it within this one, and they need resources too. So the resources pieces are still there. Open space that are safe are still vital components. And of course, you all understand they're critical components for health. I'll just stop at that.
Ron, thanks. You've really approached this concept, I think, that's going to require exploration and empiricism in the next 10 years, which is what is the impact of being digitally engaged, not engaged in vivo, the way humans were designed to be engaged, right? And we're just beginning to explore that. We could probably do hours in another subsequent conversation around that, because the mental health impacts of that are obvious, that we should know at this point that those are clear. We just haven't connected the dots in terms of impact. So thanks for that, Ron. Jack, quick reflection.
Just a second, Richard. I was going to say, I've said this for a year. What a brilliant time to be a PhD student, because you don't have to worry about trying to find a subject. There's millions of them waiting for you right now. It's all right.
That's right. Thank you. Jack, final thought from you?
Well, I could just say that one of the issues that we're hearing from our community stakeholders is trying to create a system where we go out to them versus them coming to us is very, very critical. And also building on existing traditional partnerships. There was a lot of silver linings during the pandemic. Two that I'd like to note was our strengthening our relationship with like agencies like First Five of Ventura County and the leadership at the Ventura County Office of Education. So it was really tapping into their resources, their expertise, their knowledge, and collectively we were able to share resources, share information, develop some surveys together. And through that effort, we really strengthen our relationship. And that's so critical, is to become trusted partners. And I think that's a good way of working together and identifying resources that can increase our collective understanding and commitment to better serve youth and families in our county. Extremely important. We're also looking at some pilot projects that don't have funding, but how can we creatively bring those resources together, and more importantly, make a commitment from the CBOs to support a pilot program that we could eventually seek funding for in the near future. So always looking for creative solutions to address the disparities in our community.
Thank you, Jack. Annie, quick reflection from you?
Yeah, one thing that I just want to add is, when you think about kind of inviting residents or community members into a shared governance model, or empowering them or co-powering them to give input and to make decisions with you, I think for us, what's really important is we really want to honor their time with pay, with meaningful, stipends or honorariums that will allow them to participate at their leisure or at their choice, right? I think a lot of times, I just don't see that very often, and I feel like sometimes especially government entities, go to community residents almost as like it's a privilege for you to participate in our advisory group, right? But we should be the other way around. It's a privilege for us to have their voice, and along not just with just pay, but really creating that pipeline. I mean, maybe it's a career pipeline, right, for residents to start maybe by just giving input, but having some way of institutionalizing their role so that maybe they can participate at a higher level, or they can, really gain skills and develop their own career, and maybe run for government office one day, right? Or, sit at some higher table of authority. So for us, that's been a very important theme that we've been trying to build out through our collaborative.
Annie, thanks a ton. And you reflected earlier on a model that you've used. Would love to have you drop into chat, maybe a link to that. And Steve, I'll let you spend a minute or two here on the resources, and then we'll yield to Toby to kind of bring it home.
Yeah, again, this is, as Richard said it originally, this is a conversation that to get us all to see a bigger picture so that we could then work differently. Because if we keep doing the same old, we're going to get the same old results and outcomes and the disparities and the short and miserable lives that some people have to live. And so we're hoping that this series of master classes helps you to realize that there are ways to do things differently. There are resources for you to do that. And, we spoke with the guests today, and so they'll put some resources, send us some resources. We'll put them up on the website so that you can draw down some of those. And if you have further questions, by all means, please forward them, because we think this conversation is going to continue going forward. I think, and now we get an opportunity, though Toby introduced a lot of what MHSOAC does already. I'm looking forward to his closing remarks, because he sits in a unique position to help us see further down the horizon so that we know where we're all moving towards.
Thanks, Steve. Thank you, everybody. I just want to share a couple of things that really drive the kinds of perspective that we think about every day at the Commission. One, when it comes to issues around, shared leadership and shared capacity, we're constantly thinking about, what are the models that are out there? I think Jack or Ron mentioned the citizen review panels, right? There's lots of boards and commissions. Some, I think, are very activist and engaged, and some are less so. There are grand juries. We don't have to look that far to really think about the kinds of models that we could emulate in this question about how do we share power, how do we engage, and how do we drive change. But sometimes we get a little bit stuck in our boxes around who we are and what we've done, and it's difficult for us to think expansively about the opportunities that are there. So the Commission is doing a tremendous amount of work around the Mental Health Student Services Act to really bring together county behavioral health and community schools. After years of policy that made it hard for these communities to partner, many did on their own, but many struggled to partner. What we're really trying to do is think about how we can create the right kind of incentives to support the kind of one child, one plan idea that Breaking Barriers is really presenting. Sometimes those incentives are cash. Sometimes those incentives are data, communication strategies, facilitation. There's lots of ways. And what's really important, I think, is just thinking strategically about what we're trying to achieve and how do we equip people to be successful in ways that are aligned with whatever it is you're trying to get done. It's really difficult to get people to do things they don't want to do. It's much easier to find ways to incentivize and support people to be successful in their goals. So we really think through the lens of how do we create demand or support for something we're trying to accomplish? And then how do we help respond to that so that we can facilitate success of other people? Because it's not about, in this instance, the Commission's ability or authority to do something. It's about how we can use the tools and the capacity and the opportunities that we have to facilitate success through multiple partners. And we do that in really diverse ways. Again, funding, elevating the voice of young people, for example. So, we have a youth advisory committee that we have hosted. We will be sponsoring a youth mental health event at some point. We don't know when COVID will allow that to happen, but that will be youth organized and youth run. We do this with data. We put data online about how MHSA dollars are being used. And, the world stopped for a moment when that information became public, and it fundamentally changed the type of role that different people had. Some people lost their jobs over that because it was so shocking. More importantly, what we're spending a lot of time doing is asking people, how can we help you be successful? And really trying to listen to the answers and thinking creatively about within the dollars and the time we have, we can support that success. And so, you know, the themes that Jack and others have raised around trust, around being able to, you know, shared language. Someone in the comments said developing that shared language is how we create those opportunities for collaboration. And it's absolutely true. We find that most people actually are trying to move in the same direction. What makes it really hard oftentimes is culture. Sometimes it's rules, but most of the time it's culture. And so, you know, how do we begin to make it easier for people to push past these cultural obstacles that are getting in the way and making it easier for them to be successful? And one last comment is part of that is really thinking about who's in the room. When we surround ourselves with people who are like-minded, it can be hard for us to think differently. And when we think about bullying or other kinds of behavior, we often think about sort of, you know, the people who are involved in that relationship, and we think less about the audience. But I use that bullying example to say that the audience is really important. It is almost always the audience that allows something bad to happen or that facilitates something, you know, wonderful to happen. So we think a lot about who is the audience for the work that we are doing, or who is the audience for the work that you are doing, and how can you begin to translate what's important to you to that audience in ways that they help you be successful. So, you know, I think this is really hard work. It takes time. It is swimming upstream. And the more of us who are, you know, clasping our hands and swimming together or rowing that boat together upstream, we will get there faster and better. And I just, you know, want to thank everybody for coming together and giving us a chance to talk and share just the phenomenal comments from those master guests today. Thank you.
Thanks, Ron.
And thank you, Toby. Let's just end, if we can, with a deep appreciation. Breaking Barriers, a moment of appreciation for Jack, Ron, and Annie. Thank you for bringing your wisdom to this conversation, and Toby for cleaning up for us and just setting a tone for what's coming and what's possible. I really appreciate that. Let's see. Steve, do you want to hit these for us really quick?
Sure. As many of you may know, originally we were scheduled to have our annual Breaking Barriers Symposium this November in Sacramento. Because of the uncertainty of COVID and if we could travel and all of that, we ultimately and sadly decided to move it to April. And that's the dates that you see there. But we want to still gather in November in the morning. And so we hope that you will register for that and check in. We're going to have some state level folks, some county folks, and some advocates speaking about what's happening now as a way to help us, to use Toby's idea. So we're all rowing and moving in the same direction, because I think we all have various perspectives from where we work, where we live, what matters to us. But I don't have any doubt that we're all looking to make sure that more and more people can live good and healthy lives.
All right, Steve, thanks for that. That brings us to the end of our day. Really appreciate the conversation. Thank you for joining us, and we hope to see you in November.